Nigel, and I'll probably just upload it in full without any edits. Uh, so that's my first time recording on this particular platform. Can you see the sort of the side-by-side view?
Looks great. Yeah,
Okay,
Looks really
awesome.
nice.
Yeah, so welcome guys, everyone who's watching. This is our first Xialla conversation, so it might be a bit glitchy, so bear with us until we get our footing. I'm Nigel, the inventor of Xialla, and I'm super pleased to be joined today by Dr. Dean Elterman. Uh, Welcome to Xialla Conversations. Xialla Conversations is a podcast series designed to raise awareness about the challenges of treating venous leak and how Xialla offers innovative solutions. Each episode features interviews with leading urologists in a conversational format divided into parts that explore key topics. Now I'm going to introduce Dean Elterman, Dr. Elterman, and it's a little long, but guys, bear with me. And I think the main thing that guys are interested in, from my experience when they talk to us, is knowing that we deliver a quality product that is backed by serious people. Dr. Elterman is a super serious guy, and so I think it's worth reading through what we call his short bio. You do not want to see his long bio, but I'll read you his short bio. So Dr. Dean Elterman is an associate professor of urology at the University of Toronto, subspecializing in functional urology. He holds the Lang Family Endowed Chair in Urologic Innovation. He's an attending urologist at the University Health Network in Toronto. His clinical and research interests include avoiding dysfunction, novel technologies for BPH, sacral neuromodulation, male incontinence, and men's health. He trained at the University of Toronto Memorial Sloan Kettering Cancer Center and the New York Presbyterian Weill Cornell Medical College. He holds also, if that's not enough, a master's degree in clinical epidemiology and a health services research from Cornell. He's the medical director of the Sexual Health Clinic at Princess Margaret Cancer Center and fellowship director for functional urology. He is the recipient of the 2022 SIU Innovators Award. He leads numerous clinical trials in BPH and neuromodulation and has published over 230 peer-reviewed manuscripts, including the lead author of the Canadian Guidelines for Male LUTS BPH. Lastly, Dr. Elterman is the associate editor of European Urology Focus, is an associate member of both the EAU section of Functional Urology and the EAU section of Endourology. He sits on the board of directors for the Société Internationale d'Urologie, SIU, as the Innovators Chair, and is the Chief Medical Officer of MedTech Syndicates, a platform which supports clinicians to fund MedTech innovation. So with that, I think we can confidently say this is a guy who really knows his stuff. And I'm super proud that Dean was the first doctor to join Xialla as a full bona fide medical partner. So Dean, thank you so much for joining me. And with that, I'd like to get a bit of an understanding and a bit of a take from you on this intractable, difficult problem of venous leak. And we'll chat about a bit about Xialla and see how venous leak and Xialla are connected. So I know we're short of time. Dr. Elterman is a super busy guy. He's given us 20 minutes. So I'll ask questions till we run out of time, and then we'll let you get back to work. We'll talk about understanding venous leak, patient outcomes and success stories, the science behind Xialla, and educating urologists about Xialla. So Dean, maybe you can just explain what is venous leak and why is it often overlooked in ED treatment.
So first, Nigel, thank you for inviting me to join you on this podcast, and thank you for that really far too lengthy introduction of my bio. And I will say that I'm really proud to support Xialla as being one of the first advisors and people really using it in clinical practice. I'm at a major Canadian academic center, University of Toronto. This is a Canadian product, though it's, of course, available globally. And so I think this is a real step forward in innovation for treating men suffering from erectile dysfunction, particularly those suffering from venous leak. So when we talk about erectile dysfunction, there's a lot of different causes. There are side effects from medications. There are injury as a result to nerves, for example, after prostatectomy and other types of pelvic surgery. And then there's venous leak, which we call venogenic. And essentially, if you think about the penis as a pump, you have to have blood going in and blood coming out. And when we get an erection, you kind of need to have more blood staying in the penis than you do leaving the penis, right? And so there's all these like chemical reactions taking place, hormones and molecules and enzymes, which vasodilate the arteries, they occlude the veins, they do all these different things to essentially change the ratio of blood in to blood out. And so that you can keep blood in the penis to allow for a firm erection. And the problem with venous leak is that it's difficult to keep the erection because the veins in the penis can't really store enough blood. They're kind of leaky. And the only way to sort of help it is to constrict the penis, because the veins aren't constricting themselves. They're not keeping themselves closed. They're not keeping the blood in. And so we're trying to achieve a little bit of an imbalance to get the penis to be hard, and we're not able to do it because the blood just isn't staying where we want it to stay. And so something like Xialla is designed to help compensate for this really common condition. And I'll just say that, people who have venous insufficiency or varicose veins or trauma, they may cause venous leak, but really it could also just be genetics. And a lot of men will just suffer from erectile dysfunction and they won't know why, and they'll try all different types of treatments, and it's just kind of how they're built. And so a product like Xialla, I think, is really going to help them.
Awesome. So if I understand correctly, we're trying to slow the blood outflow more, keep the blood outflow minimized, so the blood inflow is the blood inflow versus blood outflow balance is such that the penis stays hard. There isn't more blood outflow than inflow. When I talk to customers, I talk about the leaky tire. It's kind of like blowing up a car tire. You can pump it up a lot, but if there's a leak, it's either going to lose the air and you're going to get a flat, or if the leak is big enough, then you're not going to be able to get it pumped up in the first place. Does that kind of make sense?
Yeah, exactly. Like when your penis is soft and flaccid, there's blood going in, there's blood going out, arteries and veins. But when you get an erection with these chemical events, there's going to be much more blood coming in and less blood coming out. And that's what keeps the blood in the penis. But if you're leaking out, you're not going to be able to achieve a firm erection.
Perfect. So what are the current treatment options for venous leak? And what are their limitations in your experience?
Well, there really isn't anything specifically designed for venous leak, right? There are medications like what we call phosphodiesterase type 5 inhibitors, PD5 inhibitors. So these are your sildenafil, tadalafil, vardenafil, right? Cialis, Viagra, and Levitra. And these are designed to help change phosphodiesterase, which really means it's working on that chemical chain reaction, and it's preventing the penis from losing its erection. So there's things that give you an erection, there's things that take away an erection, nitrous oxide, cyclic GMP. And so this drug is really acting on the penis to help maintain an erection by preventing the breakdown of what takes away the erection. So that might, to an extent, help a little bit with all types of erectile dysfunction. And we kind of just give PD5 inhibitors, Viagra, Cialis, as a blanket treatment. We really, as urologists, don't get into diagnosing the differences between neurogenic, vasculogenic, arteriogenic, venogenic, the differences, because it's really hard to even detect it. We don't really have great tests in everyday clinical practice. So we kind of just give everybody pills.
That's an interesting admission. So you have trouble detecting whether it's a blood inflow problem or a blood outflow problem. Does that make sense in sort of layman's terms?
Exactly. Like we have very fancy ultrasound machines
Yeah.
that use penile Doppler and plethysmograph, very fancy machines, but they're really used in a research setting. They're not really used in an everyday clinical setting.
Oh, I see.
So it's very hard to even just diagnose it. And then, of course, if those pills aren't working, there are vacuum erection pumps that have penile constriction rings. If people are able to get an erection, but they lose it quickly, there are other sorts of constriction rings. But Nigel, as you have discovered with your invention, there are a lot of drawbacks or areas of perhaps lack of satisfaction that some of those rings do provide.
Right, right. Which segues into part two, patient outcomes and success stories. So, Dr. Elterman, tell us how you first heard about Xialla and what intrigued you about it. I remember I sat outside your office hoping you would come and see me. So maybe you can tell that story a little bit.
So, urologists are men's health doctors, but, urology also divides up between cancer and stones and incontinence. And so not everybody even treats erectile dysfunction. It really gets into the weeds. And, we're always looking for something new and better to be able to offer our patients, our male patients in this example. And so, what I have available are pills, Viagra, Cialis. We have vacuum erection pumps. We have injections of triple mix and trimix. And then there's sort of these accoutrements, these extra things that are out there. But urologists also aren't really well trained to say, okay, you should buy this ring or this product because they're kind of not from us. They're from Amazon, they're from a sex shop, they're from wherever, right? So it's very hard for us to know where to guide people, where to guide patients, and what to endorse, what we think is good or bad. So, Nigel, you approached me with this concept, and my job is to be the chair of innovation in urology and to understand new products. And I think what really struck me is that this made a lot of sense. This made a lot of physiologic sense. It made anatomic sense. And this is something that you really clearly have developed that is meaningful. And then when you started showing me like the early success stories from the patients, from the men who have used your product and they leave reviews on your website, I was pretty convinced. And so that's really the reason why I wanted to get more experience with my own patients and start hearing their success stories.
Right, right. Um, what kind of patients are you? Is there a specific patient that's best suited for Xialla? I just sort of lead that question a little bit. I know that there's some patients that are maybe a bit turned off by the strap and the loop type of mechanism. They're not into that sort of mechanical devices type of thing, and so maybe. But do you find there are certain patients that are more accepting of it and not, or are there certain patients that will lean toward it or not?
I have found that actually once people understand how it works and how to use it properly, they're really quite open to it and they're happy. I mean, it's probably a little bit easier if you're in a monogamous long-term relationship to introduce something like this as opposed to like being on a first date. But at the same
Right.
time, I don't think there's a particular patient profile, I have to say. I mean, we've had young people use it. We have older people use it. Of course, it's often men who are not getting the best outcome from drugs, from PD5 inhibitors. So, for example, they're able, or they cannot take a drug, so they're able to get an erection, but they can't keep the erection. So maybe something like Xialla would help them keep the erection. Or, of course, there's men who get a partial response from the medications, but they lose it very soon thereafter. And so, we often think of this as an alternative or a supplement to some of the other erectile function treatments that we offer.
Right, right. That's exactly how we market it on the website. We're clear that Xialla can work on its own, but we're also clear that we don't compete with other protocols. That we're very much you can use this with pumps, you can use it with the drugs, you can use it with other therapies. Okay, awesome. Let's jump to the science behind Xialla. Dr. Elterman, from a urologist perspective, can you describe a little bit around the mechanism of Xialla and what makes it unique in treating venous leak?
Well, I think there's no one better to explain this than you as the inventor.
Okay, well, I'll jump in.
I'll give you my impression of it.
It's the way it stays in place and doesn't kind of slip.
That's exactly it. A lot of the issue with the penile rings is that A, they're a little bit difficult to get on. B, they often work only with a firm penis. And C, they tend to roll off or move around. And so I
Mm-hmm.
think the ingenious part of this is that it fits on at the base. I think you can put it on whether you're soft or hard. And also because it has that backwards tension, because of the strap, it's going to stay at the base and it's not going to tend to move and migrate. And I think that's what's going to allow you to keep it A, comfortably in position, and B, sustain your erection and not lose it.
Right, right. Because we sometimes say to customers, it's the micro movements back and forth with each. Sex is a fairly vigorous activity, so the ring is getting bumped around, and with each micro movement, it's sort of almost pumping blood out of the veins instead of holding it in. Does that kind of make sense?
Yeah, exactly.
What advice would you give to urologists that are considering integrating Xialla into their treatment protocols, and maybe they're hesitant about it?
I think urologists need to have much broader view on the treatments that we have for sexual dysfunction. And 30 years ago, before Viagra, we had very little options. We had maybe some injections, maybe the pump was around, and that was it. And the drugs really revolutionized things and opened up the conversation, removed a lot of stigma. And I think we're almost seeing the same thing now, 30 years later about stigma, which is if you have a problem with sexual function, it's okay to add some sort of aid, some assistive device. And we're seeing it in male and female sexual function now too. So I think there's sort of a new understanding that a product like Xialla can absolutely help men. And I think there just needs to be a greater awareness amongst doctors, urologists, for example, that these things exist and that we can recommend them to patients, that they're safe, of course, number one, that they're effective, that they're affordable. And, I think that most patients have been really grateful that I even suggested it. And they can try it out, and the vast majority of them are really, really happy. So my advice, to urologists is we should keep an open mind, because I think innovation like this is ultimately going to help our patients.
Awesome. I did skip a few questions. I'm very sensitive of your time, and I really, really appreciate it. But I think we covered the bases in a really thorough way. And, guys who are listening, we have tons of information on our website. And if you're interested in Xialla, there's two options at the moment. You can either buy it directly on our website, or you can go see a doctor. If you have a doctor, a urologist, you can get a referral to a urologist who can recommend Xialla. If they've never heard of it, they can contact us, and we'll be glad to set them up in our program. So a doctor like Dr. Elterman, of course, is extremely knowledgeable about it. Even doctors that are less knowledgeable, they can read up on it on our website. So you can get it directly on our website or through a doctor. And I think this has been a great overview. And I appreciate it as our first sort of launch. We're going to do this as a series and have a number of docs do a sort of a similar profile of their recollection of their experiences with Xialla. I guess for two reasons. Number one, to spread the word to patients, but also to spread the word to urologists, because as you know, this is not a product that patients tend to talk about a lot. It's not like a new lipstick that a woman finds and she's glad to spread the news to all their friends. Guys are fairly reluctant to talk about their venous leak, their erectile dysfunction issues. It's just one of those things. So the way that we're finding we're really getting help in spreading the word about urologists is through the urology community, through guys like yourself and your peers. So we're hoping that this series of podcasts really helps to start to get the word out to your peers, your urology peers, and from them to to patients who are asking about it. So super appreciate your time, Dr. Elterman. This has been really great. It wasn't so glitchy. Hopefully the recording has worked. And again, this is our first one, and I see we're coming up 19 minutes and 49 seconds of the 20 minutes. So tell other doctors when they come on board and we do this, we will respect their time as well. We won't take too much of their time, their valuable time. And with that, I will let you get back to your patients who appreciate your incredible work. Thank you so much for joining.
Thanks, Nigel.
Okay, have a great day.